What diagnostic insights do kidney court contrast phases offer? Imagine a detailed map of your kidneys that reveals not just their shape but how they work and where problems might hide. That's what a kidney court scan with contrast can do. When a contrast dye is injected into your bloodstream, it travels through your kidneys, allowing doctors to see how different parts of the kidney absorb and excrete the dye over time. This process is divided into several phases, each offering unique clues about your kidney health and potential issues like tumors or blockages. The first phase is the non-enhanced or native scan. This is taken before any contrast is given. It helps identify things like calcifications, fat deposits, or cysts. For example, simple cysts appear dark and do not take up contrast, which usually means they are benign. But complex cysts or solid masses may look different, giving clues about their nature. Next is the corticomedullary or arterial phase, which happens about 20 to 45 seconds after the contrast injection. During this time, the outer part of the kidney, called the cortex, lights up brightly because it takes up the contrast quickly. The inner part, the medulla, is less enhanced. This phase is especially good for spotting hypervascular tumors, like clear cell renal cell carcinoma, which show rapid, intense enhancement. It also helps assess blood flow to tumors and their relationship to nearby blood vessels, making it easier to see small tumors that might be missed in other phases. The nephrogenic or nephrographic phase occurs roughly 60 to 100 seconds after contrast is injected. By this time, both the cortex and medulla are evenly bright, giving a clear, uniform picture of the entire kidney. This phase is important for detecting small kidney cancers that might not be highly vascular. It also helps differentiate between types of kidney cancer because each subtype can have a different enhancement pattern. For example, clear cell cancers tend to enhance strongly early on, while papillary types may show less enhancement. Finally, the excretory or pyelographic phase takes place several minutes after contrast injection, usually between 3 and 10 minutes. During this time, the contrast moves into the urine, filling the renal, pelvis, and ureters. This phase is useful for checking if there are any blockages or stones in the urinary collecting system. It also helps evaluate how well the kidneys are functioning, as delayed contrast excretion can suggest impaired kidney function or obstruction. Additionally, it can reveal tumors that cause blockage or distort the normal anatomy of the urinary tract. All these phases work together to give a comprehensive picture. They help doctors determine if a mass is benign or malignant, and if malignant, what type of kidney cancer it might be. For example, clear cell renal cell carcinoma often shows rapid enhancement in the corticomedullary phase and quick washout in the nephrogenic phase. The pattern of contrast uptake and washout can help distinguish different types of tumors. Beyond identifying tumors, these phases also provide insight into how well your kidneys are working. If the contrast is delayed or unevenly distributed, it might point to kidney disease, infection, or blockages. This detailed information is essential for staging kidney cancer, planning treatment, and monitoring progress over time. Repeating court scans with the same contrast phases allows doctors to see if a tumor is growing, shrinking, or returning after treatment. In summary, kidney court contrast phases are powerful tools that reveal both the structure and function of your kidneys. They help healthcare professionals make accurate diagnoses, choose the best treatment options, and keep track of your kidney health over time. If you have concerns or symptoms, always consult your healthcare provider for personalized advice and care.